Welcome back, everyone. Dr. Rodney Young from Texas Tech University Health Sciences Center School of Medicine joins us today with some health headlines that have caught his attention. And it's time for another round of Dr. Young's Medical Matters. Are you ready?
I'm ready.
All right, let's get to it. The CDC is reporting a rise in fall-related deaths among older adults. What's behind this trend?
There's probably a lot of things behind it. I guess the upside of a story like this is that we tend to be helping people live longer.
Yeah.
So there are more older adults, but one of the ways that we do that is with medications. And unfortunately, medications can have side effects. So the longer we live, the more problems we're likely to, build up over time. And the more times you visit a doctor and talk about a problem, the more likely you are to get prescriptions for that. So one of the things we have to be mindful of is all the things that have been prescribed, but also just the frailty that goes with it. Arthritis, you can lose vision, you can lose hearing, all things that help us with balance. And the older you live, and especially when you're trying to live independently, the higher your risk of a fall.
And so also kind of another thing that's coming out is a new COVID variant. And so what should people know about that, how it's impacting Americans and what you guys are seeing?
Well, COVID's been the gift that keeps on giving. We see new variants emerge from time to time. This new one is called NB 1.8.1, but people sometimes call it Nimbus, like the types of clouds that John would talk about. But really what it's known for is the severe sore throat. Sometimes they refer to this as razor blade throat. So people often want to know, like, what are the signs that might help to differentiate COVID from some other garden variety respiratory tract infection? And oftentimes it's difficult, and if we don't know that we're having a surge in the community at the time, people might think less of it. But watch out for the classic things like fever and feeling unwell and having a cough, but particularly if this Nimbus variant hits us, a severe sore throat might be a cue.
And so is this variant spreading widely across the country?
So far, it has been mostly on the coast. So the East Coast and the West Coast have had more. It's making up a total of about 11 to 12% of the variants that they've tested as of the last data collection, say a month or so ago. But if it follows the pattern that other variants have, eventually it will start to spread, and we may see some of it in our area as well.
And so we were talking about this before we got started, sweet drinks. There is some new kind of data coming out about sweet drinks and how it can impact you as you maybe get older. And so what is that data saying and research saying compared to maybe what it was saying a few years ago?
Yeah, so normally if you talk to a doctor about sweet drinks, it's all misery and never do it, right? And so this actually is a reassuring study. This is a retrospective study that looked back. Researchers followed people over a period of time to determine, how much they had consumed either sugar-sweetened beverages or artificially sweetened beverages, and tried to determine what's the likelihood that they subsequently develop dementia. And while there's a lot of bad things health-wise from sugar-sweetened beverages, it does not appear from this study that dementia is likely to be one of those. The people who had consumed more sugary or artificially sweetened beverages really were not more likely to have dementia down the road than those who hadn't.
And so there's always constant information coming out in terms of health and things of that matter. And so when people have those questions, what's the best way to go about, kind of getting these answers and getting down to, the best way to really understand what's going on?
There's a million places like that, particularly though when it pertains to public health issues, relying on the CDC or the public health department either locally or at the state level. Those are probably the best sources of information. Visit with your healthcare provider, your pharmacist. They can also give you a lot of good information.
All right, well, we appreciate you being here as always.
Thanks for having me.
We have a lot more Studio 4 coming up after this. Keep it here.